Welcome, everybody, to our podcast produced through the Institute for Academic Medicine at Charleston Area Medical Center. Our goal is to provide timely and up-to-date information on the topics that matter to you. I'm today's host, Dr. Doug Knutson, and I'm joined by our producer, Jason Likens. Jason, how's your day going so far?
So far, so good. Looking forward to hearing what we're going to be talking about today.
Well, we got two fantastic guests today to help us learn all about vaccinations in adults. Both of our guests are kindred spirit family doctors like me. The first is Dr. Ann Maurer from CAMC's Family Medicine Residency program. Dr. Maurer, can you tell our listeners a little bit about yourself?
Sure. Thanks so much for having me, Dr. Knutson. I've always had a passion for preventive care, and this topic is right up my alley. I'm an associate professor in the Department of Family Medicine at the West Virginia University School of Medicine Charleston campus, and I'm also the associate program director for the CAMC Family Medicine Residency program. Prior to my current role, I was a family physician in Clendenin, West Virginia, working with Cabin Creek Health Systems. I'm boarded in both family medicine and obesity medicine, and I spend my days seeing patients and teaching residents and medical students about family medicine.
Well, I can tell you I really appreciate the work that you do, and I want to thank you for doing all the work you do. I also know your learners really appreciate it, as your residents have awarded you Attending of the Year 5 times since you've been with the program. And I am really excited that one of your prior residents is here with us today, Dr. Pratima Ramkissoon. So Dr. Ramkissoon, tell us a little bit about yourself before we get started as well.
Thank you, Dr. Knutson. I'm happy to be here as well. I'm a graduate of the West Virginia School of Osteopathic Medicine and continued my training at CAMC in the Family Medicine Residency program with Dr. Maurer. I'm working at the CAMC Charleston Primary Care Office. I'm a huge public health advocate, and keeping people healthy is a passion of mine.
You know, and I knew that, which is why I asked you to join us here today, which is great. But before we get started, I do want to clarify something. Adult immunization is really a big topic. How would you two like to break this down for us?
It's true. There's a lot to cover. So to make this a little bit more digestible, Dr. Maurer and I decided to start with covering vaccinations of young adults. So people from the ages 18 to 49.
Right. We thought that because preventive health concerns and conditions vary throughout the lifespan, we'd discuss this younger age group first and separately address immunization of adults ages 50 and older in the next podcast.
That sounds actually really good, and I think it'll make it much more digestible. So if you're okay with it, let's start out with your thoughts on seasonal or annual vaccinations, beginning with the flu. Dr. Maurer, who do you think should get a flu vaccine?
Oh, that's an easy question. Basically, everyone. It's recommended that everyone 6 months of age and older receive an influenza vaccine every year, including healthy adults. Although the target audience for flu vaccination are individuals who are at high risk for developing flu-related complications because flu spreads so easily, it's recommended for healthy adults so that they don't spread to people who are at higher risk.
A lot of my patients historically have pushed back on flu vaccination, either saying that they never get the flu, and even though I recommend it, they say that they don't see getting a flu vaccine as really being a priority. When you have patients that are pushing back on you, Dr. Ramkissoon, how do you approach that?
That's difficult to say the least, but I usually start with a few statistics. For example, we know that millions of people get the flu every year. Even in a mild flu season, we're talking around 10 million people that get the flu in the United States. In the 2019-2020 flu season, there were 35 million people that had symptomatic disease. Of those, around 16 million went to the doctor to get treatment, 400,000 were hospitalized, and around 25,000 died from the flu.
Wow.
And in this day and age, even with the vaccine, it's not unusual to lose around 50,000 Americans to the flu every year. Many of these deaths would be preventable, but in the United States last year, only around 48% of the population got a flu vaccine.
I'm honestly surprised at those numbers. Maybe it's because I work in a healthcare system and personally I get vaccinated every year. But what are some of the reasons that people who don't work in healthcare settings don't want to get vaccinated?
Gosh, there are all sorts of reasons. Some people feel like it's not necessary. Some feel like the vaccine makes them get the flu. Some don't trust vaccinations in general, especially after some of the skepticism around the COVID vaccine. So really, any number of reasons.
Some are worried about a reaction to the vaccine, and some just don't like shots. Some people don't think that it's effective because the vaccine may not include the predominant strain in the community.
Dr. Maurer, can you talk a little bit more about that? How do you that's really complex. So how do you describe that to your patients?
As most of our listeners know, the strains that are chosen for the seasonal flu vaccines are selected each year based on epidemiologic data and global flu surveillance that helps to identify which strains are circulating at different times. This is made even more complicated because viruses mutate over time. Experts at various organizations, including the CDC and World Health Organization, analyze the data and make recommendations about which virus strains should be included in the vaccine. Then they share that information with private sector vaccine manufacturers who then develop the vaccine. All U.S. vaccines are quadrivalent, meaning that 4 strains are included. When my patients say that they don't want to take the vaccine because they're worried about effectiveness, I'm honest with them. I tell them that it's true that flu vaccines won't always work in everyone who gets it. However, even when the shot isn't as effective, it can help minimize how sick people get if they are infected and can dampen spread to more vulnerable people.
That makes a lot of sense. Dr. Ramkissoon, since you're my statistics person, my numbers person, can you give me an idea about the effectiveness of the vaccine in an average year?
Sure thing. I mean, it varies every year, but even though it's not 100% effective, it does significantly decrease the risk of getting a serious complication from the flu. In 2024, the vaccine was reported to be around 50 to 60% effective at preventing the flu.
Well, you said this a little bit earlier, but I used to have a number of patients that refused to get the flu vaccine because they swore they got the flu from the vaccine. When you run into that, how do you respond to your patients?
I do my best to counteract that line of reasoning. The vaccine in a flu shot is inactivated, meaning that you cannot get the flu from the flu shot. However, as we discuss, some people can get the flu after they get the vaccine. It takes about 2 weeks after the vaccination for antibodies to develop and provide protection. So if people complain that they got symptoms before that period, I can tell them that the vaccine hadn't had time to work yet. If they had the flu after that period of time, it is usually because they were infected with a strain that was not included in the vaccination, not that the vaccine was not working or caused their illness.
Hypothetically, let's say I know someone with a deathly fear of sharp, pointy things. I absolutely, of course, am not talking about myself here, but I can imagine some folks out there may not want to get a shot. What other options do they have?
Of course, they have some options available to them. There is a live attenuated flu vaccine that comes in the form of a nasal spray called Flu Mist. It's a good option for folks who would prefer not to have a shot.
Now, is this nasal spray as effective as the shot?
Great question. While the CDC does not prefer one version over the other, as long as patients take one or the other, Flu Mist is absolutely more effective than taking no vaccine at all. However, pregnancy, immunosuppression, asplenia, CSF leaks, and cochlear implants are contraindications to the nasal spray.
And I'm assuming that's just because it's a live attenuated vaccine.
Mm-hmm.
What about folks with egg allergies?
The short answer is that it's okay for patients with egg allergies to have any flu vaccine. The CDC has a very user-friendly page regarding this that can be downloaded and shared with your patients. They do caution that allergy to other components of the vaccine may preclude vaccination. If a patient has had a severe reaction to a flu vaccine, they may not be able to have another. And while some patients may be able to receive a different formulation of the vaccine, those primary care physicians of those patients may wish to consult their local infectious disease specialist before moving forward.
Are you good, or do you want to do that section again, just in case that was noise? Do you hear that noise, or are you good? Do you think?
Did that pick up in there at all? The chair?
Let's just go ahead.
Yeah, let's just go ahead.
Yeah,
and read
how
it.
about if you do the short answer again? Start from there.
No, the chair that I stood up from. Okay. Do you mind if we just do that one again?
Yeah, no problem. You
Sorry.
start, yeah.
You know, the short answer is that it's okay for patients with egg allergies to have any flu vaccine. The CDC has a very user-friendly page regarding this that can be downloaded and shared with your patients. They do caution that allergy to other components of the vaccine could sorry, I'm going to start again. My fault that time. You know, the short answer is that it's okay for patients with egg allergies to have any flu vaccine. The CDC has a very user-friendly page regarding this that can be downloaded and shared with your patients. They do caution that allergy to other components of the vaccine may preclude vaccination. If a patient has had a severe reaction to a flu vaccine, they may not be able to have another. And while some patients may be able to receive a different formulation of the vaccine, primary care physicians may wish to consult their local infectious disease specialist before moving forward.
That's good advice. So let's shift gears a little bit and talk about COVID. What are the current recommendations for COVID vaccination in 2024?
That's a hot topic. The CDC recommends vaccinations with the updated COVID vaccine for all adults. There are two types. The mRNA vaccines that are familiar to us and our patients as Pfizer or Moderna, as well as newer protein subunit vaccinations called Novavax.
I'm not really hearing much about COVID vaccinations in the news or online anymore. So is this still a big enough concern for doctors to recommend this to their patients?
Yes, Jason. Actually, in January of 2024, there were as many hospitalizations for COVID as there were in January of 2023. So it's becoming clear that COVID isn't getting milder and isn't going away anytime soon. I think it's in the media less because it's becoming a more normal part of our life now. However, that doesn't mean that we should ignore it. Vaccination against COVID provides excellent protection against serious disease, and it decreases the complication rate. The vaccines also do not contain egg, nut proteins, latex, antibiotics, preservatives, metals, or gelatin, so they're not contraindicated for patients with those allergies.
You know, I think as primary care docs especially, we all experience the controversy and the politics and the skepticism around the vaccine when it first came out especially, and then shortly after. How do you manage those conversations with your patients?
Thanks, Dr. Knutson. Yeah, you know that anti-vaccine sentiments became increasingly politicized in the last few years. So I do my best to stick with facts. COVID vaccines are safe and effective, and they've been rigorously studied since their emergency use authorization in 2020. I ask people to avoid misinformation that can be found on social media, and I refer people to credible vaccine information sources like the CDC, or if people don't trust that source, the Global Advisory Committee on Vaccine Safety.
Those are excellent resources, and I've used them a lot myself. So when we come back, we're going to take a little bit of a break. We'll talk about routine non-seasonal vaccination.
Scheduling your primary care visit is just a click away. CAMC Primary Care and the CAMC Family Medicine Center now offer online scheduling. Book your appointments easily from home or on the go at your convenience. To schedule your appointment, visit camc.org/primarycare.
When you're not feeling well, call 24/7 Care to talk with a doctor, physician assistant, or nurse practitioner by phone or video anytime, day or night, for non-emergency health problems like fever, cough, skin rashes, and more. Skip the trip and get better faster with 24/7 Care.
Welcome back. Dr. Knutson and I are here with Drs. Maurer and Dr. Ramkissoon discussing vaccinations for young adults. In this section, we'll talk about routine vaccinations.
Thank you for the intro, Jason. I've got a vaccine dad joke that I wanted to try out on you. Are you ready for this?
Sure.
Okay, so why wasn't the vaccine interested in serving as a witness for the prosecution against his fellow vaccine?
I have absolutely no idea where this is going, and I have no idea why.
Well, he already had immunity. Yeah, it's good,
You watch
right?
a lot of Law and Order, don't you?
I plead the fifth. But let's move on. When I think about routine vaccinations, I often think of the ones that our patients sometimes forget about, like tetanus. Dr. Ramkissoon, what can you tell us about that?
Tetanus is actually one of my favorite vaccines to give at a new patient visit. The tetanus and acellular pertussis vaccination is typically given at age 11 or 12 as an adolescent booster. Assuming those kids made it through their teenage years without any serious injuries.
Big assumption.
Right? They're generally due for a tetanus booster around age 21. I generally remind patients that they need a tetanus booster on birthdays that end in a 0, like 20, 30, 40, 50, and so on. If they've never had a Tdap, they should have one dose regardless of when they had their TD vaccine before. After they get one Tdap, they can follow up with the TD vaccines at the usual 10-year intervals. There are a few challenges with the Tdap vaccination, and the CDC website gives guidance for patients who have severe reactions, Guillain-Barré, uncontrolled seizures, encephalopathy, or localized vasculitis after an injection.
That actually seems very straightforward. And I really like the idea of thinking of a Tdap or a TD for the years that end in a 0. I might be due for one of those coming up, but I'm not going to tell you which 0 I'm staring down right now. But let's move on to MMR, especially since measles has been more of a concern in the U.S. recently. Dr. Maurer, what do you recommend?
You know, the recent outbreaks have been really concerning, and at least one of these is likely to have originated in an unvaccinated person who traveled abroad, contracted measles, and returned to the U.S. Because of this, it's not unusual for you to need proof of immunity to measles before international travel. For many patients, this proof would be either their pediatric vaccine record or evidence of immunity from titers. If neither is available, or if titers are low, 2 doses of MMR separated by at least 28 days should be given before travel. For patients who are not immune but not traveling internationally, a single dose of MMR should be fine.
With this most recent outbreak, is the CDC recommending that we give routine boosters to all of our adult patients?
At this point, no. Adults in the U.S. have presumptive immunity. However, if an adult is known to have never been vaccinated, that person should get 1 dose. If a person has gotten titers for some reason and they're low, that person should also get 1 dose.
Well, that makes a lot of sense. So let's switch gears again and talk about hepatitis vaccination. What are the current recommendations for Hep B?
So the hepatitis vaccines are a little bit more complicated. They're not a singular shot. So it is recommended for all adults between the ages of 18 and 59 to have the hepatitis B vaccine. If someone hasn't been vaccinated, they get a 3-shot series. The first at the time of the initial visit, then again 1 month later, and finally at the 6-month mark from the first shot. Many adults will have received the vaccine as a kid, and if that didn't happen, the series can start again at any time.
What about Hep A? Should that be given to everyone as well?
The CDC doesn't require the vaccine for everyone, but does recommend vaccinations for anyone who requests it, along with some people with risk factors.
You know what the next question is going to be, right? What are the risk factors that we should be looking for?
You know, I had a feeling. Men who have sexual contact with men are one of the parties at risk, as well as patients with liver disease, patients with unstable housing or who are unhoused, patients who use drugs, whether injections or not, patients with HIV who may have been exposed to hepatitis A through their job, or patients who have contact with an international adoptee are all at risk.
So for the series for hepatitis A, what does that series look like?
So similar to the hepatitis B, but hepatitis A is a 2-shot regimen. One at time 0, so the initial visit, and another 6 months later, which is the final shot. There is a combined vaccine called Twintrix that combines both hepatitis A and B in one shot. It is different than the hepatitis B, but the combination vaccine is still given on that injection schedule. To reiterate, it's given on the first initial visit, then 1 month later, and then lastly 6 months later.
Awesome. Okay, so hepatitis A is a 2-shot series, but if you give Twinrix, you give it in the same series as you did if it were Hep B.
Exactly.
Got it. Okay. Dr. Maurer, what about what about HPV vaccination? I know the guidelines have changed recently.
You know that I love HPV vaccination, Dr. Knutson.
It's true.
Thanks for asking. You are right. The age guidelines are loosening as they expand to encompass more broad age range as clinical trials prove it to be safe and effective in additional age groups. The HPV vaccine Gardasil 9 is non-valent, means it covers 9 strains of identified HPV that are known to be oncogenic or cancer-causing. So both male and female patients get it as part of their usual vaccine series before age 15. Today, it's recommended for all patients up to age 26 and would require a 3-shot series if they didn't get it before age 15 when it's a 2-shot series. The vaccine is approved for patients up to age 45, but it's not recommended yet for all patients up to age 45.
So I'm sure most of our listeners know that this vaccine is fantastic, preventing cervical and anogenital cancers caused by HPV. Is this the primary reason to talk to our adult patients about this?
Yes, we really want to prevent cervical and anogenital cancers, but HPV has a role in head and neck cancers too. Around 70% of oropharyngeal cancers are caused by HPV, and here in West Virginia, we have a very high rate of head and neck cancers. Risk factors for our population include smoking, alcohol use, and HPV infection. So with our patient population, we should use shared decision-making to offer the vaccine to them up to age 45.
Are there any patients that should avoid HPV vaccination?
You know, there are a few. We shouldn't give it to patients who are known to be pregnant. If patients become pregnant during the series, we should pause until the pregnancy is completed. However, there's no recommendation to do pregnancy testing prior to vaccination. That shouldn't be a barrier, and no intervention is necessary if a vaccine was given inadvertently during a pregnancy.
Excellent. So let's shift gears again and quickly talk about international travel. I know the guidelines are different depending on where somebody is traveling, but are there some specific things that you recommend?
Sure. At minimum, patients traveling outside of the United States should be considered for influenza, COVID, tetanus, and hepatitis vaccines. Other recommendations do vary by country and even by regions within a country, so checking the CDC's website will be important to ensuring your traveling patient gets the current recommendations. If that gets a little challenging based on your busy office schedule, many local health departments offer travel vaccine clinics.
Yeah, I think it is tough to go to the CDC website every time somebody comes in and says they're going somewhere. So, but I think it's good that the information is there. We'll try to wrap this up with just a few quick tips that will help our listeners as they work with their patients. First of all, what happens if someone who knows that they were vaccinated is tested, but the tests show that they're not still immune? Is it okay to revaccinate that person?
Situations like this are pretty common, either because someone is found to be non-immune through pre-employment screening or through prenatal immunity testing. So in many cases, if you have documentation of an initial series, the whole series doesn't need to be started over. You can get by with a booster. However, the CDC website really gives excellent guidelines on how to manage lack of immunity. Also, it's important to remember not to give live virus vaccines to women who are actively trying to conceive. Those shouldn't be given until after delivery.
It's a very helpful recommendation. Jason, any final questions for our guests?
I do have a question. How common are adverse reactions to vaccines?
They're actually pretty rare, but offices that provide vaccines should be prepared to treat anaphylaxis.
Also a good recommendation for our folks. And if people do have more questions or need more information, do you have a couple websites or places that you like to go to provide more information or to get more information?
I do. Immunize.org has a great 2-page procedure for managing vaccine emergencies that may be really helpful for our listeners. And of course, the CDC has a great website called You Call the Shots, which is a web-based training module for the folks who want to learn more.
Again, great advice. You guys have been fantastic and really, really helpful. Final thoughts, Jason?
Nope. Just happy that I don't have a birthday coming up that ends in a 0.
Well, eventually you will, I'm sure. So that's good, and you'll have to pay attention to those additional sharp, pointy things that might come your way. So special thanks today to Dr. Maurer and Dr. Ramkissoon. Next, we'll hear from Katie Lanham from our Integrated Health Network with some additional information for our providers.
For over 30 years and over 30 subspecialties, we've delivered the expertise and compassionate care only a dedicated children's hospital can provide. Our focus on quality and patient and family-centered care is unparalleled. CAMC, leading the way in pediatric specialty care.
Welcome back. We're joined now with Katie Lanham, who's the Director for Practice Transformation and Community Engagement for the Vandalia Health Network. Welcome, Katie.
Thank you so much for having me, Dr. Knutson.
So happy to have you. We just heard from Drs. Maurer and Ramkissoon regarding adult immunizations, and I was wondering, what would you like our network members to know about adult immunizations?
Thank you for asking, and this is such an important topic. I'm glad you invited us. So I really want our network partners to understand that we are a resource at the Clinically Integrated Network for advice such as patients' incentives that they can receive for a lot of these immunizations, such as flu vaccines, shingles vaccines once we get into the later population, HPV vaccines. All of our payer partners offer patient incentives that are based on the claim that is posted from that immunization that takes place. And once that happens, the patient receives a gift card in the mail, and they can use that accordingly. So I don't expect all of our practices to have all of the ins and outs and the nitty-gritty details of all of those incentives available to the patients, but I welcome them to use us as a resource for those resources when needed.
So what you're saying is that although there may not be shared saving incentives with, especially in this age population, except for potentially the flu vaccine, there are direct incentives that go right to the patient. And so our providers can actually help our patients receive those incentives by recommending what's appropriate for people in different age groups. Is that right?
Absolutely. And really using, those annual visits to capitalize on those discussions on what's recommended for those immunizations to make plans for those.
So can you talk a little bit about potential incentives for flu vaccine? Is there stuff, does that go across all age groups?
It does for most insurance providers. I won't say all, because there's no way for any of us to know all of the details of every single plan that a patient may have. But for many of those, it's anywhere between typically $25 to $50 directly to the patient for that annual flu vaccine.
That's great. Okay, good. Anything else you want our providers to know?
I think that does it.
Okay, well, thank you. I really appreciate that information, and it's so glad to have you here again. Thank you.
Thank you so much. Always a pleasure to be here.
Health Matters Today is a production of CAMC Continuing Education Media Team and was recorded at CAMC Studios in Charleston, West Virginia. Produced by Jason Likens and Chris Cobb. Scripting services by Nathan Fortney. Music by Jimmy Likens. Hosted by Dr. Doug Knutson. Thank you for listening to Health Matters Today.